So there's a pretty hot topic that goes around EMS and everything emergency services really, and that is the use of lights and sirens. So I have a special guest with me today that is a subject matter expert on this topic, and we're going to go through a variety of things, including our opinions, pros and cons of using lights and sirens, and how you can use what we discussed today to improve your education and teaching the future of emergency vehicle operators.
Welcome to Profess EMS, the podcast dedicated to educating, training, mentoring, and inspiring EMS educators and providers alike. Whether you're looking to grow as an educator or prosper as a provider, sit back, open those neural pathways, and let's get to it.
Hey everybody, welcome back to Profess EMS. Today I have a special guest with me and actually one of my best friends, Dusty, or I should say Dr. Dusty Lambert.
Good evening.
All right, so Dusty, just for people who don't know you, just give a little short bio about you, who you are, what you like, where you're from, and kind of the premise of what brings you into the discussion about use of lights and sirens.
Sure. So Dusty Lambert from North Central West Virginia, a little hometown of Jane Lou. Been in fire and EMS for 21 years as my career and a couple years volunteer before that. Um, Educationally, throughout my career, I've been a career student as well as a career firefighter. So I had my bachelor's degree in occupational safety, and then went on for my master's in safety management, and then sort of had that well, now what moment, and decided to keep on going and got my doctorate in emergency management. But specifically, I kind of use my education and my career background to focus on emergency vehicle crashes. So, particularly fire apparatus, but it's a lot of information that applies across emergency response professions. So all the first responders sort of apply to it.
So with your doctoral program, like what was your dissertation focused on?
So I looked at, I guess to give you my 2 minute thesis or 3 minute thesis, I looked at a new variable whenever examining emergency vehicle crashes, fire apparatus crashes. They often look at, what type of road conditions, what was the size of apparatus, was it an engine or a tanker or an ambulance or SUV. A lot of things that they look at when they're looking at these crashes to determine what happened, so we can get big bulks of data. So I picked up a new variable that I kind of picked up from my own experience of what were they responding to. So that really wasn't in play before. So I looked at, kind of coded the types of variables of what they could have been going to, whether that be a fire and a medical call, a car crash, lines down, or a fire alarm investigation. So a lot of different things you go to, and found out that there's some call types that have considerably higher rates of crashes, fatal crashes, while responding to them.
Right. And would you agree that you feel like that the use of lights and sirens is decreasing, or do you think it's kind of remaining the same over the last, 5, 6, 10 years where a lot of the research and discussion has been popping up in mainstream media?
I would say EMS is probably more progressive when it comes to decreasing the use of lights and sirens. Police might also, and fire in recent years, probably have been picking up on that. Um, and the reason being for that is because I've seen a lot of research that sort of supports that ambulances don't always need lights and sirens for every single call. So I think that they were early on to adopt that, but it's definitely on a decrease. I think that might also have been pushed by attorneys and legal issues, but yeah, it's definitely on a decrease in the past 5 to 10 years of being more selective to run lights and sirens.
I would agree. I mean, I've been in, education for EMS and the fire service, every facet of emergency services for the better part or greater than the past decade now. And from one of the very first initial, emergency vehicle operator course I've ever taught to the most recent, that is more of a objective and a topic of discussion is actually when to use lights and sirens or when not to use lights and sirens, and risk first reward, if you will, or really about what liability is and understanding what gross negligence is. Um, as well as on the recertification side, there's a lot of stuff that's put in there now about reading research and understanding what research is. So I think there's a lot of that stuff kind of gaining traction because, I come from, in my initial phases in emergency services came from the mantra of, well, dispatch never gets it right, that it's my emergency until proven otherwise. And I think that, kind of starting that conversation, I mean, wholeheartedly, 4 or 5 years ago, I started seeing on social media these people talking about, we don't need to use lights and sirens. I mean, some people even as far to one end or the other are saying just take lights and sirens off of an ambulance, which I can't go that far, but being selective in the use of that tool, if you will, I think goes, and hand in hand those a lot of our education's pushed more towards true critical thinking rather than just do this, do that.
Right, and that's why you're getting away from. I say we're getting away from like this was recent. It's not, but you know, ambulances aren't what they were in the '60s and '70s. They weren't just throw them in the back of a van and rush them to the hospital. Getting priority in traffic. That was the best treatment really that they had. I mean, many ambulances were ran by the coroner or the local
Yeah,
field.
yeah,
So
absolutely.
obviously there wasn't a lot of treatment going on there. So yeah, we've moved way past that in EMS to where now, hey, rather than trying to take this extra risk and rush through traffic, let's just move these basic first interventions that we know here in the hospital to these people out in the field who can deliver that at the time. So it really takes a lot of the need, as far as transport goes, to run lights and sirens. I mean, you're going to be able to keep somebody alive. So yeah, there's been a huge paradigm shift there, which is a good thing.
Right. And I think we see that a lot in education, it used to be referred to as the golden hour when it referred to trauma and different things. And now it's more of just that golden period.
Yeah.
And, the necessity to take somebody from scene and expedite transport and rapidly get them to the closest appropriate facility. A lot of those days are going by because scope of practice and education in EMS is greatly expanding. So the necessity to, oh, I got to get them there so somebody else can do something is minimizing to where it's, I mean, and that thought process is there is we have the ability to do much greater skills, much greater interventions at patient contact in the back of the ambulance and en route to the ER than we once did before. Where we may say, hey, they need this medication we know what they need, or they need blood or something else crazy, or, antibiotics, to where a lot of these systems now are carrying that. So the necessity to try to get them to there is going away, that we can do that. And I think a lot of that goes back to thinking about quality and quantity. What is a quality of care we can provide if all we're doing is fighting G forces? Are we fighting the Reaper per se? Or are we really fighting G forces on the way there? So if we're, just going, balls to the wall to the hospital in the back, what type of quality of care are we really providing?
Right. And how much time do you really save? And was that trade-off worth it? Yeah, you're right with the quantity and quality. I mean, yeah, you're saving 5 or 10 seconds, in which I encourage anybody to actually do the math on what going 5 or 10 miles an hour faster does. For the most part, it doesn't make much difference. But yeah, you're trading those few seconds off for probably lower patient care and more of an effect psychologically on the patient too. That's one of the big things.
Right.
um, the effects that lights and sirens have, mainly sirens, because that's what you hear when you're inside. But the effect that it has on not only the patient but also the driver in the vehicle. A lot of research there too. So, and it's not necessarily good. It doesn't make you a better driver, and it doesn't lead to better health outcomes.
Right.
Hearing the siren all the way to the hospital. So
So with your research and, and yours was focused mostly on fire apparatus. So where were you seeing that the majority of the major events or the fatal accidents were happening? Was it responding to a call? Was there a variance between the calls that you found?
it was way worse with responding versus returning. So that was nothing revolutionary. There's been lots of data to show that responding to incidents is way more hazardous than returning, but we're going the exact same trip from point A to point B and then back to point A. at least the fire service. So that was what made it a good population to choose from. And then in the fire service also, even though the majority of the calls ran by the American Fire Service are medical in nature, that was actually one of the lower risk responses that firefighters experienced. So there was a lot less crashes um, responding to medical calls. But what was really high was responses to structure fires and particularly anything with entrapment. So when you hear those things on the dispatch, then well, suddenly we have a lot more fatal crashes that occur. And that's controlling for, the number of fire trucks or apparatus that respond to the call and controlling for the number of calls that we have per year. So we realize that that's a lot less, smaller niche. So it's even per call, it's higher risk.
So you think mostly one of the biggest influences was just strictly emotions, not extrinsic things, just intrinsic things?
Yeah, and you could argue, it could be a lot of things, and there's been a lot of previous data that showed how risky tanker trucks were to drive to calls. Well, what types of calls do tanker trucks usually go on? Usually not medical calls, it's
Right.
usually fires. So I think that was a correlation. Obviously, they're heavy trucks, but yeah, I think that there's a very strong connection there. And the only explanation that makes sense is that there's a psychological urgency to get there, that, get there itis, get there no matter what. So we have a lot more pressure, it seems like, on certain calls. I think you could agree with me that anybody, any first responder could probably agree with that, that there's certain calls that you have higher urgency to get to.
Oh, absolutely. I mean, we think about, I know you and I have had this discussion before about when dispatch gives out that call and they might say something like cardiac arrest involving a child. Like, some things are put in there that are unnecessary to put in there that we know are causing those emotional responses.
Yeah.
And always compare that to like air medical, to where they don't know what the call is until they're in the air because they don't want to, from the flight stuff, they don't want to take that unnecessary risk. They want to just really evaluate their risk of whether they can fly or not, and then find out what they're going to. So it's basically, can I respond or not? And then what will it be?
Yeah, a lot of people don't realize that about aeromedical. There's been a huge culture shift with aeromedical because they don't have a very good track record as far as aviation safety side. I mean, there's a statistically high rate of crashes with aeromedical aircraft. So whenever they started looking at the causes of those, they were realizing that they were taking excessive risks that weren't worth it. And they determined that those risks were driven by oftentimes the patient's condition. So maybe they would take off at night with approaching weather because they knew that that was a child who, needed medical care out in a rural area. Well, it doesn't help anybody if they crash on a mountainside because, it gets cloudy or a storm blows in. So they the FAA recommended to air medical helicopters to just don't even tell the pilot what they're going to. Just give them a general vicinity of where they're going and then let them make the decision whether or not it's safe to fly. So there's no external pressures, or at least they've limited the external
Right,
pressures
right,
as much as possible.
right. And that,
Versus in EMS and fire service and police, we want as much information as we can get. And when the dispatchers don't give it to us up front, we don't sometimes get snippy about it, but
yeah,
really,
absolutely.
what are we doing with the info? So yeah.
And so as that relates to like, I know I've seen some submissions that you've put in for presenting in other places you've presented. So what's that like? I forget, what's the catchy phrase that you've used about like what you title your presentations?
Driving under the influence of dispatch. And I don't, I'm proud of that title, but I don't know how I came up with it.
Yeah.
Just kind of popped in my head one day. But you are driving under the influence of what dispatch tells you. So it's not dispatchers, not their fault, but you're being, as a driver of an emergency vehicle, you're being heavily influenced by what the dispatcher says on the radio whenever that you're told to leave station or leave home to go on a call. It's affecting your mindset and really your ability to think whenever you have that stressful stimuli response.
Oh, 100%. So I know we've talked about, there's always these sidebar conversations you and I have had about like cognitive load theory, right? So like and think about the situation for all of you listening. How many times have you responded to a call and you're getting close to the residence, and you may have a CD playing, Bluetooth stream, whatever, and you're trying to read house numbers, and you turn down the radio so you can read the house numbers better, right? So there's only so many things that your brain can process at once, and this is something I've talked about in other podcasts of the amount of stimuli your brain can take in and process, and that goes on, and that can actually be improved through inoculation training. But with that cognitive load theory, it's the ability for your brain to only process so much. So if you are, all this stuff shows if you're responding to, an accident, a call, whatever, call for service, and you're running lights and sirens, that stimulus of the sound and the visual is skewing some of your other stuff. Granted, you're in a heightened sympathetic response, so your fine motor skills can get a little bit better, but then there's that breaking point, right? So there's books like On Combat that talk about operating in levels green, yellow, and red, that when you get to a certain point, your sympathetic responses are like heightened. They're perfect, like a state of flow where your fine motor skills are just great, but then you get to that level of red and your fine motor skills actually deteriorate and your reactions deteriorate. Like your other senses diminish. Like you can actually lose uh, some of your hearing, some of your reflexes, just because, again, your brain is simply overloaded.
Yeah, auditory exclusion.
Yeah.
So whenever there's many counts of police officers who get into a shootout with somebody with a suspect, and they think that their gun jammed and it never even fired because they pulled the trigger so fast that they never even heard the shots go off. So whenever your stresses go, to the moon, um, it starts affecting your ability to perceive things, so your vision, your hearing, your fine motor skills, you mentioned that, your cognition, your ability to logic, and mainly your risk perception. So you take extra risks whenever you're under stress. Kind of makes sense if you're running from a bear to be
Yeah.
able to jump over something you might not otherwise. So, jump a small canyon. But so your risk perception changes. So your body thinks that we're in fight or flight, trying to get away from something, and I'm going to take a little bit extra risk to get there. Well, that's great in that context, but whenever you're just doing your job, it's not a good thing to take excess risks when you really shouldn't be.
Right. And I know I'm as guilty of it as anybody, to where I've heard a call where the dispatch that they gives you is just death and demise. It just sounds terrible. Like, oh God, I got to get there. I got to get there. I got to get there. But then we also think about how efficient we are there, right? So like in education wise, at least I know I preach of that whole BSI scene safety mantra, right? That's all stuff you should be thinking about on the way to a call. So we need to be thinking about, is our scene safe? Do I need additional resources? Air medical, maybe given the condition of the patient, start thinking about routes to the appropriate facility. So if we're giving you a size up of a severe burn patient, that can change greatly as compared to, hey, they've been constipated for 2 weeks, right? So we got to start critically thinking about these things on the way to the call. But do we have the ability to actually? So I mean, what do you think? Do you think that going with the flow of traffic, you can critically think about that call as well as you can if you're holding on to the oh shit bar and try not to be thrown out the window with G forces?
Yeah, no, absolutely not. And I think that could go off on another whole tangent of solutions, but the crew resource management side of things, how about let the medic who might be riding the passenger seat hear the dispatch audio, but isolate that from the driver. Driver just needs an address. And you could have mode one or mode two. I say mode, not code, so we don't get mixed up. But for urgency, maybe lights and sirens or non-lights and sirens. But really, besides an address, that's pretty much all you need. In the fire service, they're going to need to know the address and maybe an engine or an aerial or whatever type of apparatus. But that's really all they need. I mean, you should be responding with the same urgency for what you perceive as an emergency as what everybody else sees. So in other words, what we see as higher priority or more urgency probably isn't necessarily what the public would see. So if my grandpa's choking versus my child is choking, I would have equal as much concern for both of those, but an EMS person might not.
Fair.
I
Yeah, that's
mean,
fair.
you know,
Yeah.
we hear keywords like child, involving a child, and it just changes your whole mindset right from the start. So, but if you never get there, then you can't really help them much. So there's risk to be taken at certain times, but um, until you can confirm that risk is worth taking, then it's probably not.
Yeah, very much so. You know, and I think that may apply to, like a thing we've talked about of, you know, stress inoculation training, right? So of, introducing different stressors to where you become more acclimated to it, right? So we can think about, I know early on in my career, whenever I was going to calls with like lights and sirens, I mean, I'd be in the back of a fire engine and the siren and the cues going, and I'm just, boom, 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 my heart's just pounding, and it's like a fire alarm or something. And I'm just so amped up
Yeah.
from that sound. And now I can be over there just like drinking a cup of coffee on the way to the call, pulling the horn every once in a while, just, or turning the siren on, just not even thinking about it because I'm so acclimated to that, if you will. To whereas stress inoculation can, in my opinion, it's like you can take somebody who is, less experienced to where, like my comfortability going to a call lights and sirens is here, but that's after, 15 years in a career to where you can take somebody who's a year in and almost get them to that same spot just by different levels of training, right? So like what would be some things that you would recommend to help with that, inoculation stress, meaning becoming more comfortable in operating in stressful situations?
Yeah, so and what you just said is spot on. I mean, you notice that your stress levels go down over the course of your career, and there's plenty of data to show that too, that the more experienced somebody is, they have less of that physiological emotional response at the time of dispatch. So they don't get as excited as a new person would. But we can kind of shortcut that a little bit. So the reason for that is the unknown portion. So if you've been to 1,000 fires, house fires, two-story residential fire, whatever, it's your bread and butter house fire, or you've been to 1,000 cardiac arrests and worked them, and you realize that, outcomes aren't great, but you can kind of predict what's going to happen, then it's less of an arousal state for you than it is somebody who just got out of EMT class, has never actually done CPR on a real person, has been through all this and practiced it tons of times, but they've never actually got to do it. There's a lot of unknowns rushing through their head. So when you can eliminate those unknowns, either by experience or by training in a controlled environment, you know what the outcome pretty much is going to be. It's probably going to be. So it becomes more routine. So that's one way to reduce that response. And the other way would be, stress inoculation. So um, when you hear something enough over and over and over, it starts to lose its power. So if you hear a loud crash in the middle of the night, 2:30 in the morning, that you weren't expecting, your pulse rate's probably going to go through the
Yeah.
roof. Might be reaching a nightstand depending on where you live in the country. Uh, so your emotions are going to be high. You're going to be suddenly awake. But if you hear that same crash every couple hours because you know that it's your furnace that's going bad, and you hear it for a couple days waiting on the furnace man to come in, you're probably going to start to ignore it, and you might even not even wake up from it. So it really depends on the person and how their emotional response is to that stimuli, that loud sound. So we can do the same thing in emergency services. Dispatch information has a huge impact on your emotional state. So with firefighters, it's structure fires and entrapment. Those are the key words. In EMS, if I remember right, cardiac arrest is high, but anything involving children, you probably vouch for that.
Yeah.
And what else do you think is one of the bigger, like, oh, hurry up and this is a good call. Let's get to it,
Uh, I'd almost say like, a lot of scenes we don't need to rush to like fights, shootings,
right?
of things like that. The more, you know, high severity, low acuity
Yeah.
type of calls
But
that
what's
were,
more exciting, in other words, or even watching people, like when you work EMS,
oh, right. Like if
what do
you're like,
people want to not finish reading the newspaper article before they go to the truck for? What are they going to slam it down
right.
and book
Yeah.
you out the door for? So kids is number one. Cardiac arrest was up there, but crashes, car crashes, trauma and vehicle crashes
Yeah.
is one of the more urgent psychologically that EMS experience. So I would imagine that would correlate with higher crashes responding to those. But yeah, so if we can experience those in our heads somewhat, sort of visualize, we can start to take that excitement away from those type of dispatches. So that's one way to get there.
Yeah, agree. And I think about like the cardiac arrest thing, and I would say there'd even be a heightened stressor depending on the address. If you know it's an address of the local skilled nursing facility and they say 98-year-old, it's like, oh, okay, we know how this is going to go. Or they come out and they say, 16-year-old unresponsive cardiac arrest, CPR in progress,
Yep.
completely changes everything, right? Because we become more inoculated to, oh, I've been to this nursing home a dozen times, like it's 99% of the time that it's BS, right? And I think that same thing ties right back into what we were discussing about the actual use of lights and sirens, like when you should be using, going code 3 or whatever the nomenclature is of your area of using lights and sirens
Mhm.
or not.
Right.
I mean, in most laws, there was this old thing of code 1, code 2, code 3, where
Yeah.
code 1 was go with the flow of traffic. Code 2 was lights only, and then code 3 was lights and sirens. Well, most laws I've ever heard of said there's not an in between. You're either in an emergency response or you're not.
Right.
And I know this is kind of, maybe anecdotal, but in my administrative days within EMS, I was responsible for writing a lot of policies. And that was some of the first policies when I was put into administrative role that I changed because in my capacity, I was, in charge of training, basic clinical operations and overall field operations and safety. So that policy put in effect was the use of emergency response. And it was never based on what the CAD category was. If our local 911 system had 25 different CAD titles that they would use, it was never based off that. It would be based off of, you know, the description of the size up they give you. Is it listed as, or, do you get the impression that there is a threat to a person's life given that situation? If then you can take that risk, if you're willing to take that risk to go. But there was never a mandatory saying you shall. It's like these are acceptable situations to use lights and sirens because and then these ones like this would be an example of, or if it does not pertain to a situation where a patient's life may be at risk, although their cause, person should consider, I forget what the language was, but
Yeah.
basically if it is fearful of somebody's life, use emergency, go, emergent
Yeah.
response.
You
If
give
it
the
is not,
discretion to
non-urgent
let them
response.
interpret the information,
Yeah,
and that's not a bad policy to have. I mean, it kind of shuns a little bit of the responsibility back off on the employee, but I would encourage everybody to look up their state or province's emergency vehicle laws because they say something along the lines of what you said of, okay, you're either in emergency response mode or you aren't. You're driving normal flow of traffic. And when you're in that mode, what what determines what an emergency is? It's the law, so they have to define things. So it
mhm,
will say somewhere in there what the definition, legal definition of an emergency is, and it's going to be something along the lines of immediate hazard to somebody's uh, safety, life, or property from total loss or something along those lines. So, um, you know, if you have to make that decision, you need to know what that definition is and be able to defend yourself if you would go out and be involved in a crash because the attorney's going to know that you have a higher risk running lights and sirens, and you need to justify that risk to the public and to yourself and your coworkers and your patients.
right. I've even read some state law that says, or like state law or state code, depending on where it's written, that will say, just describe that the emergency response of a vehicle is basically if you're breaking any traffic law that an emergency vehicle shall use all visual and auditorial devices.
Mhm.
And it doesn't, nothing has even said like what would signify that. It basically just says if they are responding emergently, or basically if they're breaking any traffic law that you have to use lights and sirens basically.
Yeah.
And like, so when I was in policy writing and stuff, that's kind of what we said too, like that if you break a traffic law and referencing the state code, that you have to use lights and sirens. And said, if it is something that involves, like I said again, without beating the horse to death, that if it's something that is the patient's life is at risk, stroke, chest pains, cardiac arrest, unresponsive patients, choking, something that, legitimately a minute of time difference, it could be drastic, then the provider should go lights and sirens.
Right.
But if it is not a threat to somebody's life, they shall not respond lights and sirens.
Yeah.
Um, and I probably should have kept better track of this, but with those policies being in effect for a while, I can't recall like a single, like I really feel like we had a great decline in traffic accidents. Nothing major, knock on wood, but knocking mirrors or bumping into one another or rear-ending a car because traffic suddenly halted and those kind of things, those greatly decreased, great, and granted that's all anecdotal. I don't
Right.
have
But
hard research like
your
you, but
anecdote probably represents the research, because there's been plenty of cities who have switched over to a policy similar to that, to where they don't run emergency mode on every call, and it's reduced their risk. And after a few years, your insurance companies will start to notice that too, and reel it in. But yeah, it's not going to eliminate back up and into a parking meter or something like that, whenever it's just a minor parking lot incident, but it certainly will reduce the number of serious crashes. So, which
yeah.
is a good thing. Those don't occur often, depending on the size of your agency, but that's really where it matters. Yeah.
Yeah, and ironically, like in regards to the fire service, that the majority of the most severe calls, we'll say, because they're fatalities, were responding to fires, wrecks with entrapment, and so on. Whereas in EMS, the majority of the calls that are happening are during clear weather, but during transport with a patient in the back and another provider in the back. So where do you think that, I mean, I know my opinion, but what's your opinion on why that changes instead of responding to the call that most of the accidents are happening, like the recorded accidents, not the fender benders and stuff, the ones that are reported to insurance and logged and have mandatory reports through state systems. So why do you think that is?
Well, you got to look at a few variables there, because what you just said, I don't know if, do you know if it's more crashes while in transport, or more fatal crashes, or more fatalities? If it's any of those.
It was overall crashes. So
Okay, because I was gonna say, if it's higher fatalities, then it probably is, because you have more people on board when you're in
mhm,
transport. Obviously, you have at least one extra person that you didn't have there before. Um, but you also could have more fatalities because you have a provider riding in the back, which we all know it's common to not wear seatbelts in transport if you're doing an intervention of something. So that's going to increase the risk. But I would imagine that that would be very similar. If you're transporting lights and sirens and transporting a patient, the condition of that patient's probably going to delegate your mode of driving to the hospital, whether it be with or without lights and sirens. Hopefully, should drive it. And it may also be influencing drivers' um, urgency to get there. So those external pressures that I mentioned, those other human factors, um, to get to the hospital urgently, depending on what's going on in the back. So I, I I would probably base it on that. Now, I don't have data for that specifically, but knowing what those human factors are, I'm sure it carries right over to EMS.
yeah, my analysis of that would be, and it ties directly into human factors of responding to a call. We have two people up front who have the ability to be extra set of eyes. While in transport, it's a person up front by themselves, and then we take into consideration of that cognitive load thing that they're trying to drive, operate a siren, taking a hand off the wheel. So we have now, visual, auditorial, and so the siren, the radio, just overall sense of the call they were just on. Maybe they're hyped up from the call they were just on, and they're like, "I got to get there quick. I got to get there quick."
Yeah.
That the majority of those crashes are happening with one person in the cab, so they don't have that extra set of eyes and just those human factors. And where taking that time, reducing the G forces, reducing the stressors, ultimately, I think create a better environment to actually provide patient care.
Yeah. Yeah. And I would say that you're right on the right track there. I think there's two things that could be along those routes is the driver jumps in the front. knowing that snapshot image of what's going on with the patient at the time that they loaded them. And then they have that pressure to perform to, get to the hospital as quick as possible, maybe in their own head. But it seems like some of the older medics that I've worked with over the years would, you get in the back and be like, all right, easy three, something along those lines. In
Yeah.
other words, run lights and sirens, but just reminding you as a driver, I got it under control, just to get us there safe. And I've worked with many providers like that. And that's a great mentality to have, to tell your driver that. And that leads me into the next thing, which is crew resource management. So yeah, you're right. Whenever you have somebody in the front seat and you're the driver, there's a few things that are happening. You get another set of eyes to say, hey, watch out, there's a truck coming, stop, slow down. But you also have in your mind that you're responsible for somebody. They're right there. You know, they're going to tell you to slow down, hopefully, if you're driving like an idiot. So you've got some communication going on that might get broke down whenever they get in the back and start caring for a patient. So yeah, you're probably right there with both of those.
Love it when you say that.
Yeah.
Uh, so what are three things that you um, your top three recommendations to people listening like to change or consider in the way they currently function to try to reduce potential accidents?
Oh, that's a good question. There is no one magic bullet, but we know that most emergency vehicle crashes are human nature, human factors rather. It's the driver that's in the front seat. We can't blame, the old lady blaring Metallica in front of you in traffic who doesn't get out of the way. It's the driver. So when we start looking at those things, you know, good training, but how do we do that training? Uh, I think we need to instill into our drivers, remind them that it's not our emergency, it is our job. So the fact that your county has one EMS station and the whole to cover the whole county, and somebody decided to live 30 miles from that station out in the middle of nowhere, that's not your responsibility to make that time up.
Right.
You
Yeah.
didn't put the station there, most likely. You also didn't choose where that person lived or their level of provider or anything else. All those things are out of your control as a driver. Nobody really ever says that up front. Just say that. I mean, that's important to tell people, remind them that it's not their job to make up that time. So if we have that mindset just going into it, that it's not our emergency, it's our job, we're going to get there safely. Run that mantra through your head if you're driving. You could even say things like that. All right, block out that call and let's focus on getting there safely. So that's a couple different things. Just change your mindset and then remind yourself of that mindset while you're driving.
Valid.
Um, and the third one would probably be stress inoculation, which takes the power of that stressor away. It just sort of makes it a normal everyday sound. um, One of the best ways to do that would be to actually withhold some of the dispatch information until an ambulance or emergency vehicle responds on the call. And once they're en route, then give them a little bit more information of what's relevant. That would be important for the agency head and the dispatch center to hash out. But so maybe not in the control of all the listeners, but I think that that's something that could be considered anyway, is to really be selective about what information dispatchers give whenever they're dispatching the call.
Yeah, and I would say I'm gonna share one of yours. I think that training education is great. I don't necessarily think that when they get into an accident, that training and education is going to fix that. But I
Yeah.
think, the good education on like the small things that people don't consider about, hey, the faster you go, the less your sound actually travels.
Oh yeah.
Engineering of the vehicles that, hey, just because your siren is going, these new the vehicles are designed to be soundproof. The quieter the ride, the better they sell.
Right.
So they may not legitimately hear you, which goes into, the way that they're designing sirens and visuals and stuff, that they're having, more physical stimuli. Like we have some new apparatus at work that have those, I forget what they are, but they're basically subwoofers built into the siren so you can feel the sound coming.
Yep.
Um, Another one I'd say is more efficiency in operations. So I come from the standpoint of EMS kind of being more efficient medical services more than emergency medical services anymore, which that's a whole sidebar for another topic, another podcast. But if we feel the need that we're going to run lights and sirens, that it is, we have a sense of urgency, we need to have that sense of urgency from the time of the call. So it doesn't mean, finish your sandwich or, hey, hold on, I got to finish this phone call or whatever before you go, because then you get to that point where you feel like you're making up lost time. It took me a minute to get here. Oh crap, I didn't realize this call was 15 minutes away from where I'm at. Or, um, just then you're going from here, you're going from level yellow to yellow red right away because you weren't processing everything. Where we can almost get to that point of, all right, there's a call, I gotta go. And your brain starts thinking, and you can gradually build up to get more critically or clinically or psychologically prepared, and be more efficient in that. And another one I'd say is just kind of in the crew resource management thing of when we're going to calls, the person driving, their responsibility is to drive. They don't need to, have complete full function of the siren. They don't need to be talking on the radio, and the person in the passenger seat is just a passenger princess. I mean, my wife rides in a vehicle that way. I mean, she controls the radio, what we'll listen to, and the air conditioner, all that. But in an emergency vehicle, it needs to be like a joint effort, because that ties back into the vehicle crashes, that without having that co-pilot there, your crash risk is greatly increased. So everybody pay attention. Don't be going to the call, Snapchatting, taking selfies, posting videos for TikTok or whatever. Like, focus on the call, because again, that's your job. Your job is to get you, your crew, the ambulance, and your resources to that scene to make a difference. And if you don't ever get there, then you just make things way worse.
Yeah, and back to the crew resource management, it's if you're the passenger of that vehicle, then it's equally as much your job to make sure that it stays safe. So not become part of the problem. In other words, roll your windows up. Don't listen to the siren at level 10. That at least is going to tear or turn it down a little bit. But don't add to the problem. You should never tell a driver to drive faster. Those words should never come out of a passenger's mouth. Um, they're driving within their comfort realm, and you should be okay with that. If anything, you should be checking your speed, like on a GPS on your phone or something, or glance over and check in with them every now and then to slow down. Because I mentioned that stress can affect your perception. So the driver, who might be less experienced and have a lot higher sense of urgency, doesn't realize that they're going 60 miles an hour through a school zone. So talking to each other is a good thing if you're in an emergency vehicle. Your mindset might not be the same as the person who's in your vehicle's mindset. So it's important to, communicate, have normal conversation, if anything, just to bring you sort of down a notch. But
Yeah.
that good feedback of actually looking at the instrument, the dial on the dash, and see what it says, and trust that, not your perception of how fast you think you're going.
Yeah. I mean, you think about who's, like in a fire apparatus, I've seen a lot of them being engineered and designed now to have a speedometer and more controls in the officer seat,
Yep.
because even we see a lot of times in an ambulance or a fire apparatus, a person riding in that passenger seat is oftentimes one of the most experienced.
Right.
So they are the ones that, in theory should be more calm and collective. So if that person's driving with that sense of urgency, there again, it goes to, the most senior person. Hey, just, what do you think we're going to have for dinner on the way to the call? Just to try to, one of those passive ways that, de-escalate that person who might be driving a little bit too hard, instead of like yell at them to, slow down or calm down. That
Yeah.
never works when you're amped up. So
Just say something random. Purple monkey bowling ball.
yeah,
And make them, what does that mean?
yeah, a very good
What are we
distractor.
going to again? Yeah, it's just snap people out of it. It's not a bad thing, but hopefully, you just don't get to that point whenever you feel like somebody is, you know, so stressed out that they aren't paying attention, and you have to throw the grenade in the room just to get their attention. But yeah,
Yeah. So what do you think that, I know, like me personally, some things that I've changed in the EVOC courses that I've taught, emergency vehicle operator courses, are those things about the engineering of vehicles, like the sound dampening, if they don't hear you, um, really trying to explain to them the differences. Is the faster you go, the lesser your sound travels, and kind of like how sirens work and the different cadence of sirens and how far those can actually carry. And also the concept of acoustic adaptation, to where if somebody hears a sound coming, they almost start to drown it out. So if they can hear a sound and your siren is just blasting the same tone, they can almost just create that to be white noise. So they may not necessarily hear that or realize how close they are to you. And again, just the explaining things to them of, what negligence is, what gross negligence is, what the actual laws are, and like the understanding that and presenting these case studies, like here is an instance of somebody who was put in prison for vehicular manslaughter
Yeah.
because they were grossly negligent in what they were doing. They're
Yeah.
like, the accidents happen, and it's not if you get into an incident, it's when.
Yeah.
Even if it's something minor, you bumped into a telephone pole or whatever. But those things will happen, but try to prevent the big ones.
Yeah, and all those things are still important to teach in, an emergency vehicle operations course. Um, EVOC should absolutely cover all those things, but I think where it's really falling short is focusing on the human factors. Everybody would probably agree, yes, I'm not going to drive like an idiot because I don't want to end up with a lawsuit or going to jail and having criminal charges for driving like an idiot. But what we don't realize is we don't have the ability to make that decision whenever we have that sense of stress while responding to a
True.
call. So you know that it's there, but you don't have the physical ability. You don't realize how fast you're going. It's just like being drunk. You don't realize you're drunk when you're real drunk.
That's
Think
fair.
you're
Yeah, we've
way
been there.
better at things.
Yeah,
You are stress drunk.
yeah.
Yeah. So that was sort of what,
Stress drunk. I
yeah,
like that. Yeah.
thanks. That's sort of what led to my driving under the influence of dispatch because you don't realize your mindset at the time. So yeah.
So what are some like stress inoculation things that you'd recommend to take that human or mitigate that human factor in an EVOC course?
So things that I started a few years back was dr- during driver training, just replay some of the high stress sounds that people are going to experience. So the main source of stress prior to arriving on scene is everything auditory that you're taking in, the radio and the sirens. So let's control the sirens. So what's the radio saying to us? Well, we know that certain calls are more stressful than others. So what if we just replayed certain dispatches that are high stress as you're driving around normal, just in the flow of traffic, no lights, no sirens, but bring up YouTube and replay some dispatches that would be high stress for you. So in the fire service, play the audio from some structure fire dispatches. In EMS, play some audio from some dispatches of calls involving children. Um, they could be real or made up, but you're hearing the same thing that leads to the stress stimuli over and over, and you're controlling how you respond to it, making it just one of those background sounds that you mentioned. So that would be a good way to just sort of get rid of the power of the dispatch.
Yeah, those are all awesome thoughts. I really like that, the stress drunk. Yeah, that's pretty good. So yeah, I think that, if there's any big takeaway from this today, it's just to start having those discussions, like, and the tailboard talks, the talks at the table, and your trainings. Just, do we really need lights and sirens on all these calls, or if we do we need it just to, prevent being in a traffic jam? Do we really need to be excessively speeding? Like, I've never written a policy that gave anybody permission to speed. The big phrase out is with due regard,
Mhm.
right? And that's a very blanket statement in the legal realm of that you were considering everything safety. So really start having those conversations. There's always going to be some heads butted, but I think that's a very much a conversation it needs to have. There's a lot of research that's out there. Dusty's research is published too. To read into that, it's a great resource. But yeah, really start having those discussions about whether we really need to run license sirens on every call. Is it, you know, do I think it could ever go away? No, I do not. But I think it is something that we need to not use and abuse.
Yeah. What's the Spider-Man quote? I don't watch movies, but great power comes great responsibility.
Yeah, that's
Sort of the same thing.
a
We
very good
have a
point.
lot of power. to drive through traffic without regarding the red lights, but we have to take that responsibility serious because we are increasing not only our risk, our patient's risk, but the public's risk. So many bystanders get taken out annually from emergency vehicles. So yeah, we gotta respect that a little bit more.
I agree. So
Spider-Man.
I think it respect the Spider-Man. Yeah, so I think those are all great points that we could easily implement into our initial EVOC courses or our driver refresher training. That is a thing that is required by NFPA. So it's something that can be questioned of where are your driving records, where's your continual driving stuff. So yeah, so just some food for thought on those things. So um, stay safe, everybody, and try to avoid, what was it you said? Stress drunk?
Don't be stress drunk.
Don't be stress drunk. All right. All right. Thanks all.